I'll go like this if I need to.
All right. Are we on? Oh, hi. Welcome to,
Sorry.
welcome. Welcome to our Facebook Live chat. This is week 7 of doing this. I'm Dr. Bill Bird. I'm the Chief Medical Officer here at the hospital. And I have a couple guests with me today that I wanted to bring in who are part of teams that are on the 2 touch points at CGH that take care of patients who have COVID-like symptoms. And so I'm really happy to have that. My first guest is Dr. Dave Kavanaugh. Dave is the medical director of our emergency department. He actually works for Team Health, who we contract with for our emergency department medical staff, and Dave's on our medical staff, and he's been with us for several years now. Does a great job.
Thank you, Bill.
And yeah, so welcome.
Thank you. Thank you very much.
Notice, give feedback to Dana, to our crew, if you can't hear us. We're a little bit further apart from the camera, just so that we can have our.
We are social distancing.
We are having, yes,
keeping our 6 feet apart.
Yeah, we're trying to do a good job with that. So, yeah, so Dave, you were, and by the way, you'll see Dr. Kavanaugh if you really like him and you decide you need to go to the ED. You'd see him from 7 p.m. to 7 a.m. most days, right?
That's right. Best hours to be there, right?
I can't. His schedule is like you work from 7 p.m. to 7 a.m. What time do you sleep till?
About 11:30. Yeah.
In the morning.
In the morning, right?
And then
you have a full day of stuff to do after that.
Do you take a little nap before you start at 7?
I do. I usually go over to the apartment and I take a little, like 5:30. I decompress for an hour and watch some mindless movie on TNT or something. It's usually an Avengers movie. I don't know. So I'll just sit on the couch for an hour and watch something and eat some ice cream, and then I'll be recharged. Yeah.
Yeah. Wow. Anyhow, so Dr. Kavanaugh leads a different existence than I do in terms of his schedule. So, all right, let's get into some questions here that at least I had, and then for the people that are on the line listening, any questions that you might have for Dr. Kavanaugh as well. So, first thing that came to my mind was, since March, whatever this has been, March 14th or whatever, what would you say some of the biggest challenges that you and your team have had?
Well, this whole thing is full of challenges, and I think the biggest one that we're experiencing and everybody's experiencing is what to do next. What's coming next? How do you plan for this next? Because we don't have a playbook for this, right? We don't have a historical precedent for this to look back on. And whether you're talking about how we move patients, how we deal with them initially, how we staff our places, and then what the guidance is, from the CDC, from our state, from our local, and then from our medical staff. I think that's the hardest thing, is day to day, just how do you manage this and be on top of everything.
Yeah.
It takes a lot of effort.
I agree. It does. Yeah. Yeah, good points. How do you feel like, in terms of that, the ground's always shifting, where do you feel like we're at now with that?
Well, I was actually just talking with one of our nurses probably 30 minutes ago who was on maternity leave and just came back.
Yeah.
And we were talking about how initially it was literally every day. Every day something was different or something was modified, and you had just sent out some kind of blanket message to everybody about, this is how we're going to do X, Y, and Z.
Yeah.
And then the next day it's, oh, you remember that email I just sent? Yeah, forget that. We're going to do something different now.
Right.
It seems like that is spread out. Now it's not every day, every few days. Now we've developed some processes. We understand these things a little bit better. We understand how this is affecting people and then what we're doing and looking for. So that, I think, is the thing that's been very good recently, is our processes have kind of stabilized now, and we know what we're doing day to day. It doesn't change as much.
Yeah, that makes sense. So if you would, just talk through the process that's in place right now. First of all, if I'm a patient who shows up to the emergency department, talk me through those patients who have COVID suspect symptoms and the process once they hit the door for the patients who have chest pain.
Sure.
How would
sure.
that happen? How would that work?
Well, I mean, as a lot of us know, the COVID suspect symptoms have sort of mushroomed into this much larger umbrella, and it's not just fever, cough, and I've been to China. It's lots and lots of different symptoms. We have diarrhea, we have loss of smell, just general upper respiratory symptoms, cough, shortness of breath. So you're someone that comes into the ED like that. First thing that happens when you hit the door is you get a mask, right? Because our frontline folks at the door have a mask. You get a mask. Our triage nurse then goes through some very detailed questions with you about your history, your travel, your contacts at home, the symptoms you've been having, and then we define really for you what is the best place within our department. And once that has been determined, we have a specific area that has been sealed off from the rest of the department that we call our bubble, and we have one upstairs too, bubble, right? But it's a sealed off area that we are putting our COVID suspects. So if you come in and you have some shortness of breath, some cough, some fever, something that sounds, this might be someone with COVID, you're going to be masked, put back in one of these rooms, and then the nurses that take care of you are also fully covered in what we call PPE, the personal protective equipment, with their masks and their face shields and the gowns, and we go through then our normal, usual care with you,
Sure.
as far as figuring out what's wrong with you and what we need to do
Yeah.
and testing. Now, if you're someone that comes in with, I hurt my ankle, or I have chest pain, then you still get the same initial evaluation. You get your mask, you have the triage, the questioning, and we've now determined that you don't need to be in that bubble. The same care that you've always had here is what happens. You're put into a room that's not into that bubble. The same nurses, doctors,
Yep.
technicians, everybody that you have been used to dealing with, the community is used to dealing with, the same level of care, the same kind of tests and treatments are all still there, and the rapid care, the timeliness of care is all still there.
Yeah.
So that's really important that people don't forget about what is still here, and I think we all watch the news and we see, I'm sort of segueing a little bit onto this, I'm sorry, and we see these images.
Dave's a good segue. You're a good segue.
We see these images of New York and Chicago and these sort of videos through a window of this chaotic, scary, terrifying emergency department, and everybody rushing around in what looks like spacesuits, and I'm sure people at home look at that and say, okay, I want nothing to do with a place like that. And fortunately, we are blessed right now. We're not experiencing that, right? We have made our space in the department for people who we think have these symptoms. We put them there, but it otherwise looks like normal life. The rest of the department, we are wearing masks. We're masking all of our patients, but it's not what it looks like on the news. Our department still looks and functions like it always has, and if you need something, right, if you have a broken ankle, a twisted ankle, you have some other symptom, a stroke, you have chest pain, you have things that need attention, and any other time need attention, it still needs attention, right? So you still need to get this looked at, and the fear of what you've seen on the news, hopefully we can allay some of that, because everything that you still need is still here.
Yeah. Yeah, and as you say that, it reminds me how good a job that between yourself and Sarah Alvarez-Brown, the nursing manager and for the ED and her team, you've really put together a process that if you have, whether you have COVID symptoms or whether you're someone who has just a broken ankle, it's all good. You know, it's all good. Everybody's safe. So that's really good to hear.
It is. It's important to understand that we still need to take care of you. We have to then also have this other thought process of protecting you, right? And that's why when you first come in, you have a mask put on, even though you're not sick, right? We want to make sure that you're protected, but you still get what you need here. And I'm sure that sense is out there about the fear of what it looks like, what the hospital looks like. But if you need emergent care, then you need it, and you still need to come in and have us take a look at you. Don't sit at home with it.
Sure. You know, one thing I'd ask you is, what if your patient's in the gray area where they come in and it sure seems like, because as you mentioned, COVID symptoms and heart failure or emphysema, there's some overlap there. So can you speak to a little bit of how you deal with those patients and what steps you take?
Sure, and you're right, there is a lot of gray area. There's a lot of overlap because we don't know immediately, we don't know right away whether that's what you have or not. And not everybody with COVID has a fever. And not everybody with a fever has COVID, right? So if you have symptoms that are respiratory, if you can't breathe well, you're having trouble with your coughing, whether that's from shortness of breath, from heart failure, or from emphysema, people like that, we are assuming you may have COVID, so we're protecting you to the maximum ability.
Yeah.
Yourself
Hey, 1 second
and
before,
your staff.
they tell us we're supposed to talk louder.
Oh, okay.
So we'll talk louder, sorry about that.
So if you have a respiratory symptom, okay, let's just be kind of basic about that. If you have a respiratory symptom, whether it's from COVID fever, heart failure, emphysema, we're going to put you in this protected area. Okay, and in that protected area, we rule you out. Okay, that's with our testing and our evaluation to see where this is coming from. So initially, we're gonna have you in this protected bubble area. If you don't have respiratory symptoms or symptoms that we think could be COVID, then you're not going to be in that area. You're going to be in you can call it the normal
Sure.
ER.
Okay.
Can you hear this? Okay, am I?
Yeah.
Okay.
And I think part of too, when we're talking to each other, we're probably going to answer more to the
Gotcha.
that way, and that I think our voices will project
Okay.
better that way. So, I think the thing that I've heard is that a patient sometimes would have heart failure and feel like they have heart failure, and yet they're being placed in the bubble. And the thing I would say about that is we're erring on the side of to protect everybody, that we would if any sort of symptoms, we're going to err on the side of saying, yeah, we're going to rule you out for that, and we'll treat your heart failure at the same time.
Right. And if I can speak to the testing a little bit, in the hospital, we don't have rapid testing per se. However, our testing is coming back very quickly. So if you're someone that has chest pain, heart failure, whatever it is, then we've given you this label that you might be a suspect. We are able to get you tested very quickly, and if it's negative, then you come out of that area in the hospital, then you're in a normal room. You don't have to stay in some area like that for days and days or weeks, as it could have been initially when things first started. So as Dr. Bird said, it is really important that we err on this side of safety, because we want to make sure that you are safe, that the people around you are safe, people taking care of you are safe, and it doesn't take us that long to rule it out or rule it in and then have you in the right area to be in.
And if you are in that bubble area, you're still protected and safe.
Correct.
Speak to that a little bit, Dave.
It protected and safe in the sense that in case you are harboring this illness, or you mean just the general care?
Well, I'm just wondering if I were a patient and I come into the hospital and think, it's my normal emphysema flare-up, and now you're putting me in front of and all this around all these folks that potentially have COVID.
I got you. So you are safe because you're not. It's not a communal room. We're not putting you in a room with other sick people. You're in a individual private room, closed door. You have a mask on. You're not in contact or in any kind of close proximity with any other patient or any other sick patients. The nurses that care for you, the doctors that care for you, are wearing protective equipment that gets changed between patients, and you are terrific. And so yes, so you are in your own isolated space, which is safe, which we have taken all the measures that you could possibly take that are recommended by the CDC and all the medical societies to keep yourself and the staff and those around you safe. So yes.
What would your message, Dave, be to the community?
Well, my message right now to the community is it's good to have a healthy fear of this, right? You need to be smart, do the things that are recommended as far as keeping away from other people, social distancing, washing your hands all the time. It is recommended that we wear masks when we go out into places. If you have to go to the store, the pharmacy, those are very, very important measures. If you are sick or feeling sick or having any kind of symptom that we've discussed, the fever, the coughing, shorter breath, some of the respiratory symptoms, loss of smell, these kind of things that we're figuring out. You need to stay away from people. It's very important that you stay away from people until you're not sick. As far as our facility, our department, our hospital, it is here, it is open, it is safe. It is a place that if you need something, we're here to take care of it. If you're having significant problems, if you're having the things that people have frequently, the serious abdominal pain, difficulty breathing, chest pains, stroke symptoms, unusual things that happen that require some care, some evaluation, then you need to have that. And this is a safe place to do it, and you'll be taken care of the way you always have been.
Good, yeah, appreciate that, very good. I would add on the masking, we will put a mask on you, but I would still ask that you, at least even when you come in to the ED to be, if you have your own mask, at least to wear that in as you kind of come forward. We're asking that for anywhere at CGH, or whether you're at one of our clinics or the emergency department, to wear your own mask when you come in. And one other question, Dave, and I'll let you go. Like, who right now are you testing?
Right now, today, we are testing patients that are under suspicion in our department that we are admitting to the hospital. We are testing patients that are from communal living centers, nursing homes, group homes, healthcare workers, frontline workers, paramedics, firefighters, police, folks like that. That right now is the groups that we are testing. This is something that always evolves,
Yeah.
but right now that's where we are with what we have available.
Good. Anything else you wanted to add? That question you thought I would ask that I didn't ask?
No, you will probably notice a big, I don't know, depends on how you perceive it, scary looking tent in front of the hospital.
Oh, yeah.
That has elephants and giraffes and people in it, so don't worry about it. It's something that we didn't know if we were going to be using, if we were going to need. We, at this point, don't need. So it's not something that you have to worry about. Do I need to go to that? Do I not need to go to that? It shouldn't be something that should either deter you or create any type of fear about the hospital and what the situation is like in the hospital. It's currently not being used. Yeah.
Matter of fact, I wouldn't be surprised in the next few days if it may not even be here. We're still, it's been rainy and it has to have a certain amount of time to dry out. So when that has happened, it's going to be gone. So yeah, anyhow, yeah, that's the deal. I'd shake your hand, but that's not happening right now.
We're not shaking or fist bumping. There's some elbowing going on, but yeah.
Dr. Kavanaugh, always a pleasure. Thanks to have you with us. And I'll talk to you in a few minutes because we have another meeting.
We do, don't we? Yes. All right.
All right, thanks.
Let's go.
All right, we're going to have you roll your chair out, Dave. And then we got another chair that's rolling in.
Yeah, exactly.
Yeah, no contamination there. All right. Dr. Lucky,
Hi there.
welcome. So I have with us now Dr. John Lucky. And Dr. Lucky is a family practice doc down at the, we call it the professional building, and it's downtown.
Yeah.
It's downtown. And Dr. Lucky has a family practice and also oversees the work done at ReadyCare. And so I'm kind of short notice. I gave
I would have been dressed better.
and I actually,
be on this.
yeah, and I appreciate that, and yeah, so glad you could join us, and I wanted Dr. Lucky pretty much the same questions that I asked Dr. Kavanaugh, but so if you have COVID-like symptoms at CGH, we continue to direct you either to the emergency department, if you have more severe symptoms, or ReadyCare if you're not quite as severe, but your primary care physician felt like you needed to be evaluated. So those are our two touch points still for COVID symptom patients. And so yeah, Dr. Lucky oversees the ReadyCare side of that. And I wanted to ask him some questions about how the COVID process is going down there at his clinic. So what would you say some of the biggest challenges that you all see at ReadyCare, Dr. Lucky?
Yeah, so I think, like Dave had said earlier, our initial challenge was trying to find a process to get people through quickly and safely, and with constantly changing recommendations and guidelines, it's difficult to try to stay on top of it, and that's been our biggest challenge, to try to do it in the right way and in the best way we could do with the space we have and with constantly changing information. And that's what, like he had said also, that things have gotten a little bit much more streamlined, and we've gotten a process in place rather quickly, and now things have changed a little less dramatically on a day-to-day basis, so we've been able to hit a better stride and be even more efficient.
So just like I was asking Dave, John, when a patient shows up to ReadyCare, how does it work if they have COVID-like symptoms, or if they come to ReadyCare and they have, they think they might have a bladder infection? So can you talk that through, how you guys take care of those folks?
Yeah, at ReadyCare, right now we're getting patients mainly through two veins. We'll have folks that were directed to us from their primary care provider, usually with concern that they could have COVID symptoms, and they're being asked to call the clinic rather than walk in, which basically decreases risk of exposures as much as possible. And so when you would call, if that was your situation and you called the ReadyCare clinic, you'd be transferred to one of our triage nurses who can talk to you about your symptoms, talk about what's going on, and your medical history, get information for you, and from that point decide, do you need to be seen? Do you need to be evaluated? Is this something we can give you some advice over the phone, and maybe give you help with some work note if you need that for documentation from work, and help you stay home in quarantine if you have mild symptoms or things that we probably wouldn't evaluate in the office, probably wouldn't change your care. And that's a great majority of these people and patients that have COVID symptoms. The great majority of us can be kept at home and stay home until you're feeling better, and we can help you talk you through that. If you do talk to the triage nurse and they felt like you needed to be evaluated, then you would drive down to the ReadyCare clinic downtown Sterling, across from Kelly's is what we tell most folks, or next to the farmer's market, and we have a big tent up now. We're evaluating COVID suspicious patients with symptoms outside. It basically reduces risk of transmission both for you and for the provider, and they will give you instructions specifically on where to park and call and tell us that you're there, and then we have you pull into the tent, and then a provider will come out and talk to you, do a brief examination that we can do in the car, take some vital signs, get an oxygen level, etc. And then if any testing needs to be done. Initially we were doing a lot more flu testing, which has changed, but if you have a sore throat, maybe we want to do a strep throat culture on you, which we can do from there, have you wait outside for that result, and then if after discussion and your particular situation we decided that you needed to have COVID testing done, we can collect the swab there, and that'll be sent off, and we'll give you, anything you need to have as far as medications or treatments or notes, and get you on your way.
So a couple questions from that. So who are you guys testing for COVID right now, John?
Yeah. So the same thing, mainly as the emergency room. The patients we're testing are either folks with medical histories that would put them at a high risk for admission to the hospital. So people with, poorly controlled diabetes, respiratory disease, immunocompromised state, something that would make them suspicious that testing would be important going forward, and how you would be treated that way. And then as well as any frontline workers, healthcare workers, people from community living, some factory worker situations we've run into have been tested, nursing home work staff as well. So very similar to what the ER is doing.
Okay. Yeah, so once again, so if a patient, they get a laceration to their arm.
Right.
When they show up to ReadyCare, one more time, do they call that number still?
No, so again, if you are in the outside of any COVID suspicious symptoms, a urinary tract infection, a minor injury with none of those other symptoms, and you walk into ReadyCare, someone will greet you at the door, have you wear a mask, confirm that you don't have any of those symptoms, check a temperature, and if that's all not there, we'll have you come into the waiting room and come in for a normal visit. We have a separate provider that's just seeing the inside patients, the things that are not COVID suspicious, and then we have providers and staff that are just doing the outside evaluations for COVID suspicious to keep some separation there. And the requirements for personal protective equipment is different for those folks. So you will wear a mask when you come in if you don't already have one on, and we'll be distancing in the waiting room. If there's anybody waiting, we're really trying to minimize anybody being in the waiting room, but that is at the mercy of how many people are there at the time. and getting people back into rooms quickly so everybody is as distanced and isolated as they can be.
Good, good. Let's see here.
And as if you happen to walk in to Ready Care without having called first with COVID, any kind of symptoms that could be COVID, and when they meet you at the door, give you a mask, they'll have you return to your car and then call and speak with the triage nurse in that situation so we can direct you appropriately.
Right.
Because realizing not everybody's going to know to call before they come down. So.
Right. Good. What would your message be to the community, John?
I mean, we've fortunately, actually, good and bad, seen a very big drop in numbers of patients coming in, which tells me that people are, listening to recommendations, only coming in when they absolutely need to be, listening over the phone when we say, hey, you can stay home and treat this at home and let us know if things get worse. And even in my primary care side, people have been very patient and reasonable about rescheduling appointments and realizing we're in kind of an uncharted territory and things are changing on a day-to-day basis. So continue to be patient and realize your frustrations are our frustrations, and there is no right answer to a lot of the questions we have at this point with what we know. We're all frustrated with testing and lack thereof at times when we want to run a test just for curiosity's sake or for scientific sake, but we have to be within the confines of what we have available, and it's going to continue to change hopefully, but be patient and realize we're not trying to be difficult. When we tell you we can't test you, or we tell you to go home and there's nothing more we can do at this point to just manage your symptoms at home as best you can, or we need to reschedule an appointment for something that's not urgent or elective, be patient and realize it'll get better in the next, hopefully, several weeks to several months. So.
Yeah, so I did have I'm looking down at my phone because Dana's texting me questions that folks have.
Right.
And one of the questions was, how long is it taking to get test results back for Ready Care right now when you do test people?
We're still getting within a few days, so anywhere from, I believe, 1 to 3 days was the last time I heard results back. So much better. Initially, we were 5 to 8 days, so it's definitely improved. So our turnaround's better, and
yeah, it's compressing at least somewhat, right?
Yes.
Yeah. What else was I going to ask about that testing side of things? In the hospital, I will tell you that in the hospital it's about 24 to 48 hours, so a little bit quicker in the hospital, which is good because obviously those are the patients in the hospital that we very much, want to get the results back as soon as we can, because if they're negative, then we can not have to have them in the COVID unit and not have to use all the PPE that we otherwise would use for them. And I think the other point that you made, John, is that right now, we're still saying for the vast majority of folks, if you have symptoms, but you otherwise feel okay, just hang out at your house.
Right.
Keep to yourself, quarantine yourself at your house.
Right.
Until you feel better, because really there's not much medically that we're going to do.
Right.
Yeah. Now, granted, at some point in time, so this is how things, I think, with this will change, is at some point in time, to your point, John, we will have more testing.
Right.
And when we do have more testing, then how do you see that changing in terms of how that plays out?
I mean, ideally, when you see cases go down and then we can start testing symptomatic people, then you can be more selective in who you're isolating and having stay home based on a positive or a negative test. And that's ideally, I think, what we'd all like to see, because that allows people that aren't sick or COVID positive to get back out and live their lives and not be in this quarantine any longer. So, but that will depend on testing.
Do you want to talk? Have you read a little bit about that contact tracing and what that looks like? You want to speak to that, John?
I mean, contact tracing basically is, anybody within your contagious window being tracked down and, encouraged either to be tested or to be quarantined until they're proven to be negative or have no symptoms, which is a huge undertaking, depending on how out and about you are, which is where social distancing comes in and why we ask people to stay home. If you turned out positive and you could have been contagious the last 7 to 10 days or longer, if you think about any person that you came in contact with in that time frame, and then any person they came in contact with in that time frame, it can exponentially grow very quickly, and that's why we really try to ask people to listen and stay home as much as they can and not do that, because it becomes impossible after a certain point to actually track down who's been exposed.
Sure. Yeah, and that's part of, I think the thing that over the next weeks to months
Right.
will be more testing, and then I suspect that on the government level, our local health department, state health department will have more workers that will, kind of their job will be to find, okay, someone tests positive, and then, okay, who around them, who's been around them, test those people, make sure all those folks are getting tested, and then follow that through and make sure that those folks are staying quarantined. Because if you do that, then,
You cut the head
oh
off.
my gosh, I like that. Yeah, so you cut the head off.
Right.
And that ultimately, along with longer term, is going to be more some of these medications and vaccinations. But
Right.
yeah, so good. Any other questions that you thought I was going to ask you that I didn't get a chance to?
No, I think we're there. If you need something, call us or come in and just, like I said, be patient with the process. It won't be the way that it was before if you were at Ready Care before coronavirus took over, but we certainly will get you in the right direction and have you evaluated as much as we can and start in the right process.
Good. Hey, thanks for coming in.
Thanks.
I'll let you get back to your clinic. I know you
No.
popped out of your clinic, so
All right,
thanks,
thanks.
Dr. Lucky. All right, so what I want to do here in remaining time we have is I've been getting questions, but I wanted to take and get a hold of, have Dr. Kavanaugh and Lucky kind of speak to what they knew, and then I'm going to go through the questions, and if there's anything that didn't get answered, I'm going to go ahead and get those answered. So the first one is, how are people with COVID-19 quarantined, and what if they don't do that? Okay, so quarantine is right now, let me see here. Okay, quarantine right now is you say, okay, go home and be quarantined, and then the health department follows those folks and tells them how long they need to be quarantined. So that's kind of the process with that. Let me get this back here to let me open this up. Come on now. All right. I'm going to go back to the very first questions and make sure I kind of answer these in order. And so if they don't do that, then if there is, my understanding, if there's like blatant not following the quarantine recommendations, then that's where law enforcement and also the state's attorney get involved with folks. And I forget the legal term for it, but it's like a stay-in-place order that those folks get if it becomes known that they're out and about and shouldn't be. Okay. Let's see what else we have here. Tell us about contact tracing, how it works, and who does it. So I think I did speak to that. What percentage rate recover? So I guess it depends on that question how sick you are. So if you're sick enough that you need a ventilator, those patients don't do particularly well. The latest I remember reading was if you're over the age of 65, I think it was, and if you're in a ventilator, then I hate to throw this number out, but I think it was like 85% of those patients eventually pass away. If you're younger than that, the numbers are better, but not great. If you're sick enough that you need to be hospitalized but don't have to be ventilated, those patients obviously do better in terms of their percentages. And I think the thing that we're going to find out over time is, I think we're going to find out, and this is what we're starting to see, is when they study like prisons and they've had an outbreak and they test all the prisoners, there's a huge chunk of them that have the infection but don't have symptoms. And so I think over time, when we say what percentage of people recover, it's going to be more about how many actually got infected and what actually is the percentage of people that get sick, and then what's the percentage who actually pass away from this. And I think that's evolving, because the last one I saw in a prison outbreak was like 96% of the prisoners didn't have symptoms, which is, obviously it's a very high number. Okay, so this I think was about the ED one. Do you put a new, better made mask on when we get to the emergency department? I should have asked him when he was here, but my understanding is, yeah, they'll put a surgical mask on you, which is better than the cloth masks that folks, we ask people to wear around if they're going to be within 6 foot of people in the community. Let's see here. Okay, this one says WebMD states 97 to 99% of people recover. Yeah, that sounds fair. I think if you were to take the of the symptomatic people that get COVID, right? So you have this huge bucket, it seems like, of people who don't get symptomatic who have COVID. The ones that do get symptomatic, 80% stay at home and can recover at home. 20% need to be hospitalized. I think 5% end up in the CCU, and of those 5% in the CCU, 2.5%, 2% end up passing away. So that sounds about right. Let's see here. Masks make healthy people like me more apt to get sick. If you don't wear the mask right, you're right. If you don and doff the mask properly, I don't know that I respectfully disagree with that comment. But yeah, I think it's all about how you wear the mask in terms of whether it helps you or hurts you. Which, by the way, we have that, don't we, Dana? We have that on our Facebook page and on our website. You can see one of our infection prevention nurses show you how to properly don and doff a mask, and it's really helpful. So I would encourage you to take a look at that. Okay, let's see here. How long does it take for test results to come back? What do we have available for testing? So right now what we have available for testing are continue to be send out tests that we're doing. So it's to, and it tends to be the vast majority of the tests that we're sending out are not to the Department of Public Health and the state labs, but rather to private companies that are doing the vast majority of those tests for us. I was just on an IDPH call this morning, and what the IDPH labs are pivoting towards doing is, they don't have this huge capacity like some of these private companies do, but what they're pivoting to doing is testing areas where there are clusters. So if there's a nursing home that's beginning to have multiple cases, the state lab will then test everyone in that facility. If there's a prison where there's an outbreak, they'll test everyone in the prison. So they're being more targeted with the state laboratory work that they're doing. I think so they get a good quick turnaround time and really answer those questions for those kind of places. Let's see here. Are you testing in nursing homes? By and large, the nursing home side of thing is being handled by the Department of Public Health. Now, if those patients get sick enough they need to be here at CGH, then yeah, we're testing those patients. But in those nursing homes where there are outbreaks, by and large, that's being handled by the state. Let's see here. What's next? How do you contact trace if a grocery store worker or a food delivery person becomes infected? Yeah, that's a good question. And so it's going to be, I've never done contact tracing myself, but my guess would be that you'd have the person who's doing that contact tracing would have a conversation with that grocery store worker or food delivery person and just kind of talk about who are the people that they have been in close contact with. Once again, the key there is close contact, because not to say that you can never get infected by a grocery store worker if you went through a checkout line and they checked you out, but it's much more likely if you're someone who lives with that person or spends extended time with them that you would get infected, and I suspect that's what the contact tracing is doing. Let's see, do you have any idea when hospitals and clinics will allow more than just the patient in for an appointment? I would say that, don't hold me to this, but in my mind, that's going to be in play through the month of May. So in terms of the shelter in place that the governor has in place, I think we're going to probably stick with that through May. That's subject to change, as all this stuff is with COVID. and that at the beginning of, towards the end of May, we get more guidance from the state, and then we make more of a decision about whether we can loosen that here at the hospital and our clinics. Let's see here. When will the blood test be available to everyone? Great question. I don't know the answer. When you're talking blood tests, I think you're talking about that antibody test. So I'm not sure. They're talking like that's going to be available here in the next 1 to 3 months, which would be really helpful. Once again, those antibody tests, though, they're not, at least right now what I'm hearing, it's not like you do that blood test and you go, oh, I'm good. I have antibodies to this, I can go about my business. It's more about getting some sense of the penetrance of cases in a particular area and the likelihood that you'd have some herd immunity. But for one particular individual, at least so far when I'm hearing about those tests, is they're not quite accurate enough that we would test someone and just say, go about your business. Let's see here. Testing for the general public. Yeah, seriously, I think you know about as much as I do about when that day is going to be. I've heard from Dr. Fauci that beginning of June-ish. I do know that what we would like to have is about 500,000 tests a day that we could do in our nation, and right now I'm hearing that we're doing about 230,000 tests. So that difference there, that 250,000 tests is kind of that would allow us to do more of the folks who have symptoms, that contact tracing, and those type of things that we're just not able to do as much as we'd like right now. Let's see, are you tested for COVID before donating blood? I don't know. I don't know. We can get an answer to that, and we'll post it for you. Someone thinks people are dying more from being intubated. Okay, so the whole question about are people dying more because they're being intubated, I think definitely the trend from what I'm reading for these intensive care units is that they're not as quickly intubating people as they were. First of all, because it seems like with this disease that you could still be breathing okay, maybe breathing a little bit faster and shallower, and your oxygen level may be lower, but you're still getting enough oxygen to the rest of your tissues that even though in theory most diseases you would intubate that person, that we can get by longer before doing that. So that definitely is the trend across the country. That being said, some people still need to be intubated, and if you do need to be intubated, it's still not particularly good news if you have to be intubated. Okay, and then are we recording deaths not actually COVID? Yeah, I think there's some thought that particularly early on, when we weren't quite as aware of all this, that there may have been some folks who had symptoms that were COVID, and they may have not been placed in the COVID bucket in terms of COVID deaths. I think they're getting a better handle on that now, though. Is rash a symptom? Yeah, I've read on it. It can be. It's not a real common one, but it can be a symptom. We have to, at least our clinical team is aware of that. If people have an unexplained rash, that we would have a pretty high index of suspicion for those patients. I think I've cranked through as many as I could. I appreciate the audience's patience, because this was a little different podcast, and not podcast, but a little different Facebook Live, in that I was actually interviewing someone, and I was getting your questions, but I was also wanting to make sure that they had a certain amount of time to be here and had to get them moving. So thank you for being patient with me, and hopefully at the end of this you've had all your questions answered. So once again, thanks for listening in. Thanks to you for continuing to do the right things. I think our medical staff is doing a great job. Our nursing staff is doing a great job. Thanks to our marketing folks who are doing a good job of getting the word out. If you have other questions, obviously you can continue to post those onto our Facebook page or our website, and we'll do our best to get you answers to those questions. So until next week, stay safe, and we'll talk soon. Thanks.